They're calling it Operation Gold Rush, and here's everything you need to know. Yesterday, the Department of Justice announced the takedown of the largest ever coordinated healthcare fraud scheme, which resulted in a loss of $14.6 billion in false claims billed to Medicare, Medicaid, and private insurances. 324 people have been charged, including 96 medical professionals. Of those 96, 25 are doctors and 24 are nurses. The nurses include RNs, LPNs, nurse practitioners, CRNAs, and nursing assistants. Pharmacists are also amongst those charged. Most of them have been charged with conspiracy to commit healthcare fraud and Medicare billing fraud. They are facing federal prosecution and loss of their medical license. Millions of dollars in assets have already been seized. It also included 2 non-nurses that have been charged with fraud related to nursing for selling fraudulent nursing degrees and transcripts. Here we go again. And 1 for delivering a false nursing license and practicing as a fraudulent LPN. It has been a highly sophisticated, coordinated international plot to defraud the American healthcare system. It has spanned all 50 states and several countries. They stole over 1 million Americans' identities, including patients and providers, so that they could submit fraudulent Medicare claims. Primarily for DME, of all things. They laundered this through over 30 U.S. medical supply companies that they had purchased for the purpose of billing and defrauding Medicare. For example, they billed Medicare for $10 billion in unnecessary urinary catheters. They also subjected many end-of-life patients to completely unnecessary procedures like skin grafts. Additionally, they prescribed high reimbursement generic drugs without ever assessing or reevaluating patients, and they billed for services that were never provided. Now, some of the nurses, it seems, are starting to lay the groundwork for saying that they were bamboozled into this. They were approached by a company to do this. I don't know. I can't wait to hear the details or the excuses that come out of this. But here's the bottom line. They defrauded taxpayers, they drove up healthcare costs, and they victimized patients. What excuse do you have?